Right now we've got Amy. Amy is an aesthetic nurse. She actually comes from maternal and child health, which is awesome, and she's still teaching at a local college, which I think is really cool stuff. Amy is here today because she had some complaints about her tear trough, and she's basically complaining of a little depression here that she's noticed that as she's a mountain climber, she's very fit. As she's gotten older, she's noticed that she's had a little bit of volume deficiency there, and that's what we're gonna try and treat today with some filler. So what I'm gonna do is I'm gonna numb this area up. We're gonna make a little port right here, a little port right here, and we're gonna use the cannula technique to get the filler up to fill this part of her lower eyelid to make that tear trough look a little better. So let's get started. So it's just a little alcohol pad we're going to use to clean you off. Sorry about the smell, it can sting a little bit in the eyes as well. And this is just some lidocaine, just a little poke. 1, 2, 3. 1, 2, 3. So we're going to let that work for a couple minutes just to set in. We're going to be using a new product today. This is called Versa by Reveness. This will be my first time in using this product, and I think I've heard great things from people, and we're just trying it out. So Amy's being a rock star letting us try out this new product today, and we're going to use this for the tear troughs today. We made our little poke here. I'm just going to use the port to make a slightly larger poke. So I've asked Amy to just ice a little bit, and what that does, it just helps to decrease the blood vessels, just to constrict the blood vessels a little bit so that there's a slightly lower chance of bruising. I think the cannula technique is also great for cutting down on the bruising as well. And obviously you can see Amy's removed her mask, which I asked her to do. I'm wearing an N95 mask, and we're gonna get started. This is where it just feels a little funny. You're gonna feel this little poke.
Actually don't feel anything.
Good, that's what the lidocaine is doing. And then you're gonna feel a little strange sensation under the skin here. And what I'm doing is I'm kind of just following my needle all the way out. I want you to look up for me. And that really just helps show you. It just feels a little bit strange, not super painful. How would you say? Do you think this is painful, or?
It feels like a pinch, a little bit.
A little pinch under the skin maybe. You can see what I'm doing. I'm kind of just threading it under the skin. Just spread it out. I don't want to just get a big lump. The nice thing about the hyaluronic acid fillers is that they're actually fairly malleable. So if you do get any lumps, you can kind of smooth them out with your finger. Amy is in great shape, so she really doesn't need much. But because she's in such good shape, that's why you really notice the volume deficiency here. If she were overweight, you really wouldn't notice this as much because we tend to retain more fat. But because Amy is climbing mountains and doing cool things in her spare time, as she gets older, she's going to notice a little more of the volume deficiency. So with my finger, what I'm doing here is I'm kind of just, if I see a little thing that starts to look like a lump, I'll just smooth it out. I'm trying to stay right on top of the bone here. And it looks pretty good. I'm going to just push a little bit here. Get a little bit more over there. Make sure you get the lateral part of the eyelid as well. So I'm going to come up this way now. We really got the tear trough, which is our main problem. Now I'm just trying to sort of blunt, this can feel a little strange here, just to blunt that transition between the lower eyelid and the cheek, that lid-cheek junction. That looks nice. So now if you're ever unsure, what I'm gonna have Amy do is lean forward for me, and just the light coming down helps to kind of give us a sense of where things are going and how we're feeling about it. I think that looks pretty nice.
Feels weird.
Yeah, right? Good. A little bit more here. Go ahead and lean back for me. And this is what it's all about. You're just kind of just seeing where you're at, where the product needs to go still. About 75% of what I wanted to inject. I'm feeling pretty good about this. So I'm gonna have Amy turn and look at the camera for me. This is, we've done the right side here. We've not injected this side. So this is the immediate result. What's gonna happen over the next week or so is that it's gonna absorb water, and the swelling from the injection is actually gonna go down. And so this will really smooth out. If you touch here, it feels pretty smooth right now. But that's what I'm doing as I go. I'm just kind of smoothing out those little tiny little lumps and bumps. of product, but by threading it, I'm really minimizing how many bumps I'm forming, and it really should just be kind of nice and uniform, down and low, close to the skin, to the bone. Cool, so I'll have you lean back now. We're gonna do the other side. That looks pretty nice. I'm gonna just show you real quick so you can see where we're at.
Oh yeah, that's a big difference. Especially on this side, because this was the side that was the most, I feel like, the deeper side.
Yeah.
So yeah, big difference.
Cool. You definitely don't want to overcorrect with the tear trough, because you can run into problems with swelling and then it gets too swollen. So I'm going to make a little poke here. I can see exactly where I made my Lido poke, because I have some blanching there from the epi and the Lido. There's our port. I'm going to feel for a cannula. You can see it there tracking into the skin. I'm going to go all the way out. Yep, that feels super weird. There's the product going in. Really injects nice and easily. It's pretty smooth. And Amy's really not taking much product to get what we're looking for here. Again, I'm just kind of threading it, making sure that we're distributing that product evenly so that you don't have like a big lump anywhere. Am I hurting you?
Nope. Just makes your eyes water a little bit.
It does a little bit, yeah. Once that Lido kicks in, it's a lot better. Really not much filler, actually, so we're getting a really good result here. Like I said, resist the urge to overcorrect, because it'll swell up on you and then you gotta dissolve it out. Go ahead and look up for me. Good, thank you. It's really good. I'm gonna have you lean forward for me. Go ahead, get a little bit more there. Good. Lean forward for me. Closer to the nose there. A little harder to get to with the cannula, but I think it's worth still trying, just because, as opposed to the needle technique, because I think the risk of bruising is so much better. Also, just obviously with any filler, what you're worried about is a vascular problem, where you're injecting filler into a blood vessel or around a blood vessel, and so with the cannula, it's much harder to do that. It can still happen. Good. That's much better. Go ahead and lean forward for me. I think we're just going to do a little bit, lift your head up a little bit and look up for me. Okay. Go ahead and back. I think we're like 75% there. Probably feeling pretty numb now.
Yeah, I don't feel anything.
Yeah. After a couple minutes of injecting, it really starts to go numb. So basically, I'm just following that tear trough, threading the filler around, making sure that we're getting the little depressions, and every once in a while, you just stop and check and see how you're doing. So go ahead and lean forward for me, chin up a little bit, and look up. Good. You're okay. Now with filler, it's important to realize that you're not going to correct the color. So some people have dark circles under their eyes. That's not because, some of that is because of the shadow where you have a volume deficiency, but even if you fill that, it may not correct it 100%, because some people just have a lot of blood vessels in the lower eyelid. So we just finished the injection. Amy, can you tell me a little bit about how that went? Like what was your experience?
Pretty painless, like, for what, having something so close to your eye, you don't really feel it. There's a little bit of pinching, like I said, getting like past the cheekbone. But then once the injection starts, it's, as he's placing the filler, it's pretty painless and very easy. Awesome. And the results are amazing. So good job. I
think she looks great. I think you've got a really nice, what we've done here is filled in the tear troughs, and this is the immediate result. It is going to change over the next week or two, and really I'd give it a full 2 weeks before I judge it. But I think she looks great right now on the chair, and so we'll see how she does in the next couple of weeks.
Great, thank you so much.
Thank you.